I'm the co-director of the National Center on Elder Abuse, and I am a faculty member at the University of California, Irvine School of Medicine. I started working in elder abuse when I had a patient who'd been abused, and I was shocked and outraged by the lack of response. And as I started looking into it, this was very early in my career, I realized that I was a big part of the problem in terms of lack of knowledge, lack of response, that really physicians didn't know very much about elder abuse, and there was very little science behind it. So I started working with some of the social service folks and criminal justice folks, and it all evolved into some of the center work that I do now. One thing I learned when I was surprised at lack of pursuit was that the folks who are entrusted to do this, the adult protective service workers, are woefully underfunded, oftentimes haven't received the education and training that they need. And part of the reason for that is we don't have enough good science and research behind really knowing what the root causes are and what the best solutions are as well. I think it's difficult to talk about elder abuse, first of all, because we oftentimes just have this visceral reaction to it that just can't be really happening. Or it can't ever happen to us or to someone that we love. Yet it's really happening much more commonly than we realize, and it is happening to people that we care about and love. It's often hard for us to imagine that somebody could hit a vulnerable elder or sexually assault a vulnerable elder or neglect somebody to death, but that's happening as well. I think one of the problems in our society is that there still is a lot of ageism. There's a lot of fear of growing older. There are a lot of myths about what it means to grow old. And so we have to ask ourselves what we want to do to grow old in a healthy way to minimize our risk of becoming victims of abuse. But the other thing that we really, I think, are afraid to confront as a society is any of us could be abusers as well. And I think that most people who abuse older adults are not bad people who need to be locked up. They're stressed, they're overwhelmed, and they don't know what else to do. This doesn't excuse it at all, but it helps me understand what we might be able to do to prevent abuse from occurring and to help people at early stages. Financial abuse is probably one of the more common types of elder abuse that occurs. And there is this slippery slope that happens where, well, I'm going to get that inheritance anyway. What difference does it make if I get it just a little bit earlier? Or mom, I think, always liked me the most, so I'm just going to start helping myself to a little bit more without my siblings knowing about it. And people start perhaps knowing it's a little bit wrong, and then it can build and build and build. I think one thing we really need to do is educate people to say, this is wrong. If it feels a little bit wrong, don't do it. Have other people involved. Don't be doing this in secrecy. And sometimes when people are helping mom, they start helping themselves to a little bit more as well. And I think the other thing people don't realize about financial abuse are the devastating consequences it can have, not only emotionally, but physically on an elder as well. Elder abuse is the harm that occurs to an older adult, physically, emotionally, and otherwise, as a result of an act by another person. And there are a lot of different types of elder abuse: financial, physical, emotional, sexual assault, and neglect as well. I think neglect is one of the really is one of the least understood forms of elder abuse that occurs. And that's when an older adult isn't provided with what they need in order to have just a reasonable life going on. So people who are neglected are often found in very filthy circumstances, sometimes end up with horrendous wounds, malnourished, dehydrated, etc. Financial elder abuse can occur by a family member, which is actually fairly common. It can also occur by unscrupulous sorts of scam artists who are around. One recent example was a plumber who was called upon by an older adult, a woman in her early 80s who needed help, and she didn't want her children to know that she couldn't handle it. So really out of a concern of losing her independence, she wanted to handle this on her own. The plumber brought her a bill, and the bill started to go up and up and up. So what started as something like an $800 job escalated into thousands and thousands of dollars. And then he started demanding payment of her, started knocking on her door, started calling her. And what did she do? She withdrew. She stopped answering her door. She stopped answering her telephone. Her kids didn't know why it was hard to get in touch with mom now. She missed her doctor's appointments. She ended up in florid heart failure, hospitalized, and ended up in a nursing home as a result. The thing that she most dreaded, being put in a nursing home, losing her independence, is what occurred. And who would ever imagine that this woman, who now is fairly demented and living in a nursing home, you could trace this directly back to the plumber who scammed her. And it unfolded over a period of about 9 months, but there's just an absolute direct link back to this event. Physical abuse occurs when an elder is hit, sometimes burned, and shoving. Those are some of the forms of physical abuse. Having things thrown at them occurs as well. And this is when we'll see people who have bruising, broken bones. And one of the real tragedies about elder abuse is that many of the changes of aging that are either normal or common can mask or mimic signs of physical abuse in particular. So older adults do bruise more easily. Older adults do have weaker bones and have broken bones more easily. And so one of my fears is that we miss elder abuse because we say, well, they're just old. My other fear is that we accuse people unfairly of having abused an older person when that really hasn't occurred. So we really have to have a team approach between physicians and social services and the criminal justice system so that we are finding the right balance between appropriate protection and help and not unfairly accusing people, because that can happen as well. Family members can help by helping us understand what the needs are of an older adult. And I know that when I'm seeing a patient who does bruise very easily, that I might be making notes in my chart sort of indicating what's going on and that I don't have concerns about elder abuse. I think family members, first of all, are the most common perpetrators of abuse. And so we tend to think that it's that paid person who's doing this to mom. Well, the reality is it's most often by a family member. And again, I don't think family members are evil people for the most part. But what happens is they just get so frustrated. They're getting asked the same question over and over and over again, or they have somebody pulling at them, or they are trying to help somebody get dressed who becomes resistant. They get frustrated and end up hitting, shoving, knocking a person back who ends up with a broken bone. This doesn't excuse treating somebody roughly, but by understanding this, I think we can really move toward prevention. Sexual abuse in older adults is one of those things that we just don't like to think about. We just, as awful as child sexual assault is, a lot of people can't believe that this happens to older people too. We know it does occur in nursing homes. We know it does occur in private homes. And in people who have a dementing illness such as Alzheimer's disease, it can occur and they might not be believed if they say it happened, because after all, they have Alzheimer's disease. Or they might not even be able to tell somebody it happened. I know I've seen pictures sent to me by family members who live across the country sending me a photo saying, do you think something is wrong here? Because they know I work in this field. And they'll show horrible genital bruising that occurred, and it was discovered at their mom's death. She was sent to the mortuary, and the mortuary said, something is wrong here. Your mom is bruised. Were you aware of this? And photographs were taken, and she had awful bruising in the genital area. And when the family brought this to the attention of the nursing home where mom was living, they said, well, that sometimes happened with catheters. That is not true. That does not happen, and it really deserved a full investigation that never occurred. It is hard to comprehend how anybody could sexually assault an older adult, be it in an attempt to make fun of them or belittle them or just for somebody's sick gratification. But we do know that there are some people who have serious pathology in terms of their own mental health who do this. And despite our aversion to even thinking about it, we have to acknowledge that this can occur and take it seriously. It doesn't make a whole nursing home bad, but it does mean that you have somebody working there who needs to be really dealt with by the criminal justice system, who's very dangerous. And you can bet that if they've done this to one person, they haven't stopped there. I think that just like pedophiles find ways to get to the most vulnerable children, there are people who do that with older adults as well. And they'll seek out the most vulnerable older adults who often are both physically and cognitively impaired. I think background checks make a lot of sense depending on what state you live in. They may or may not occur. Depending on the type of background check, they may or may not be effective. And I think there do need to be more stringent rules related to this for protection, really, of some of the most vulnerable members of our society, which just currently don't exist. Same with licensing sorts of requirements. Well, the first thing when it comes to issues in facilities is I still want to emphasize that the majority of abuse and neglect occurs at home, not in facilities. And the majority of facilities are not being staffed by bad people with psychopathology, but there are these folks who slip in, and I think they slip in because they know they can get to vulnerable adults in some of these facilities. So I think family members need to ask questions. They need to listen to their relative when they say something is wrong. One thing I really look for in people who have a dementia such as Alzheimer's disease is a sudden change of behavior. All of a sudden they seem agitated or they react with fear to one particular person. Again, you don't want to unduly accuse somebody, but you have to pay attention to those sorts of clues and take it seriously. And when I have a concern, I'm getting that person undressed and looking for any evidence of wounds or physical signs that they're frightened when I'm looking at them that might indicate that something bad has gone on. Many of the age-related changes people have noticed, people in their 70s and 80s might notice, gee, I bruise a little more easily than I used to. Or many are diagnosed with a condition called osteoporosis, weakening of the bones, and so it's not uncommon as we get older to have things like hip fractures. So these things can mask or mimic signs of elder abuse because you also get bruised when somebody hits you. You also end up with a broken bone if somebody shoves you or treats you very roughly. You can end up with a pressure sore as a result of abuse or neglect. Sometimes, though, pressure sores happen despite adequate care. So it really takes a lot of effort on the part of the scientific community, meaning physicians, forensic nurses, along with the criminal justice system and social service system, to understand the context in which something has occurred. If I see somebody who has bruises, they might be on a medication that makes bruises look really, really bad, such as aspirin or sometimes medicines people are on for heart conditions or to prevent stroke. But even if that occurs, that you're on those medications, why is it that you're bruised on your neck? Why is it that you're bruised on your face? Why is it that you're bruised under your arm, places that you don't tend to bump? And these are the kinds of things that we really need to look at and say, well, how did this occur? And why isn't anybody able to provide me with a reasonable answer? So I'm often looking to see if the wound or the injury fits the history that I'm being provided. In people who have Alzheimer's disease or other types of dementia, they might not be able to tell me what happened. They might not remember. So I'm also looking at clues based on how they're reacting. Do they seem to withdraw in fear every time a particular person comes by? Or do they just seem like all of a sudden they're upset and they hadn't been for the past several weeks. Those are the kinds of clues that I look for. I do think that we currently don't do a good enough job in terms of medical care for older adults, certainly, and that you do end up with a lot of different providers with poor communication. I'm a firm believer that you want to have one primary care physician who knows you and your family and is the quarterback along with the patient and the family. This is a team sport. Medical care is a team sport, and really the leader needs to be our patient and our patient's families to help us know what that person's values and goals are so that we're providing appropriate care, that we're avoiding duplicative medications, that we're really looking closely at medications that cause side effects, and we're not in that awful loop of treating the side effect of one medication with another medication. And you can sometimes trace 7 medications along that pathway, and with devastating consequences for people. I'm sure in my medical career I've stopped more medications than I've ever started for my patients. Having primary care oversight with a doctor, nurse practitioner, whoever your primary care provider is who knows you well, I think is a very important and helpful way to be on the lookout for elder abuse and also prevent it from occurring. I think if folks know that we're being vigilant, if folks know that we're just going to ask questions, not in an accusatory manner, but, gee, do you know how Mrs. So-and-so got that bruise there? That's being asked and attended to, that just has to help. It's often difficult to know how common elder abuse is because we don't have a blood test for it. We can't wrap something around your arm and say, oh, you've got elder abuse, or draw a sample of blood and say, well, you've crossed the threshold. So we're dealing then with a lot of definitional issues. But what we do think is that it's occurring in about 1 out of maybe 10 older adults at some point during their life after the age of 65 are going to experience abuse. And that's a lot of people. When we talk about people who have a dementia, such as Alzheimer's disease, that number goes up to about half of the people with dementia at some point will experience some type of abuse. The numbers are staggering. It's estimated that for every report, at least 5, and probably the really good studies now are showing as many as 24 are going unreported. So we have the tip of the iceberg sort of phenomenon. And I think the other thing we know is that elder abuse, by the time it is reported, identified, and something is being done, it hasn't been going on for hours or days or even weeks. It's usually been going on for months or years, and the consequences are devastating. We don't know if elder abuse is becoming more common because we just don't have the good data behind us to say that. But here are some of the concerns I have about the incidence of elder abuse. We know that the fastest growing segment of the population in the United States are people over the age of 85. We know that about half of people over the age of 85 have a dementia. We know that a lot of people in this age group also are dealing with physical frailty. So we have this exponential increase in the number of older adults who are among the most vulnerable to being victims of abuse. At the same time, the number of caregivers is going down, family members and paid caregivers. So we have this intersection that I think is very worrisome. And it, to me, only means that elder abuse is going to become more common. As opposed to child abuse, by the time you're an older adult, you've already assumed your full autonomy, and you get to be treated, as you should, as an autonomous individual. So unlike child abuse, if we suspect something bad is going on in a home, we have the authority to take the child away. The same is not true in elder abuse. So some older adults would rather remain in their own home and be abused than be moved into a nursing home. And in elder abuse, it is often the elder who gets re-victimized because the only solution is to pull them out of their home for their protection. and they really might not want that to happen. Instead of necessarily pulling out the perpetrator, sometimes you pull out the perpetrator and that person is also the caregiver. So now how are you also going to provide the care that this person needs? So we also know that with particularly things like financial abuse, that older adults, just like everybody under the age of 65, has a right to make a bad decision. Children don't have the same rights to make bad decisions that we do as adults. So now how do you know when something crosses the line and mom is making perhaps a bad decision versus she's really been scammed and this is a form of abuse? At what point do you have the right to take away her autonomy to make bad decisions? So that now, for example, your father is changing the will because he's in love with a 22-year-old woman who claims to be in love with him. It gets very, very difficult to figure out when you cross this line and when we actually have the right to protect somebody. And in order to protect them, take away their right to make their own decisions. There's a lot of gray area that occurs, particularly with financial abuse. So you have an adult child who somehow never made it out of the home, never was really able to sustain having a job for a long period of time, was always dependent on the parents. And maybe one spouse dies and this situation continues. And now, even though they continue to be dependent, say, on mom starts to become more frail and require help. And the child now starts taking over finances and maybe helping themselves a little bit too freely to the finances, to getting the code for the ATM card. And it all just starts to happen gradually until it becomes much more obvious to the rest of the world that something bad and wrong is going on here. The interesting thing about elder abuse is why is it that we even have this term elder abuse? And what is it that's magic about the age of, depending on what state you live in, 56, 60, 62, 65? There's nothing magic about the age. What does occur, though, is vulnerability to abuse and neglect increases with age. And so if you're a very healthy, active 80-year-old or 90-year-old, you might not be all that vulnerable to abuse or neglect. But we do know that that vulnerability does increase as a consequence of aging. As we get older, we become more vulnerable to abuse and neglect for a variety of issues. Some of those issues are physical. You become more frail, you might need more help with things. Some of them might be cognitive, where you're having some memory loss and require some assistance with handling finances. And some of it is emotional and social, which is you really want to stay home, you want to stay independent, and people know how to prey upon a lot of those different vulnerabilities. It also means that you have more people involved, sometimes with very intimate aspects of your life. So not only do you need help with grocery shopping and you need to be handing over money or your ATM card for them to help you with that, but now you need help with bathing and grooming. You need help with activities where people are helping you get undressed, where people are touching you a lot more, where people are perhaps handling you to help you get out of bed, and maybe that handling becomes rough, and maybe that can translate into true physical abuse where people are actually getting hit. And this just gradually tends to happen as we get older when we need more help. It also becomes an emotional leverage point, so that if people know your main objective is to remain in your home, they can now threaten you. If you don't sign this over, I'm going to put you in a nursing home and I won't continue to help. That's a very powerful and abusive sort of a message. People with dementia have memory loss and other forms of loss related to their cognition. They may have trouble with judgment, reasoning, finding their way around in the world in terms of spatial relations, trouble with language, both saying things and being able to understand things, to a point where they're not able to function as they normally would have. So these people become more vulnerable to a variety of types of abuse. One thing I've observed is that in the early stages of a dementia, such as Alzheimer's disease, when you sort of look good and you're physically still strong, This is when you tend to be quite vulnerable to financial abuse. You're losing it a little bit in terms of memory and judgment, and people know how to manipulate you. And a lot of folks have radar for folks who are in this early stages of dementia and really know how to get their credit card numbers, social security numbers, etc. In the more middle stages of a dementia, when you might have behavioral problems, where you might be a bit combative, where you might not understand what's happening, and be resistive to care, this is when we tend to see physical abuse occurring. People are getting hit, shoved, handled very, very roughly. In the later stages of dementia, when you might be totally dependent for care, is when we often see neglect. So somebody who can't get their own food or water, somebody who can't get out of bed, and then those people may become malnourished. They may end up with really awful pressure sores, and so we tend to see neglect. And so as you go through different stages of dementia, you actually can go through a sequence of different types of elder abuse that become more common. There's no doubt that people who have a dementia, such as Alzheimer's disease, can end up abusing others. They don't understand what's going on, and they might end up hitting somebody. There are cases where they've shot somebody who they love because they didn't recognize them. And so abuse by a person with dementia absolutely can occur. The question then becomes, what do you do about it? And these are not people that you want to lock up and put in the criminal justice system, because they truly don't understand what it is that they did. But you also need to deal with it head on and protect the person who's being abused, and also figure out how you're going to help stop this from happening. Sometimes it's a matter of a combination. I would say not even sometimes. It's a matter of a combination of a number of different things you have to do. The combination to prevent this usually involves education of the caregiver, making sure the person with the dementia doesn't have some underlying illness that isn't being adequately treated. It might mean stopping a medication. It might mean starting a medication. It might mean looking at the physical environment that they're in, because sometimes the physical environment is actually causing some agitation and upset as well. So you have to take this holistic approach when somebody with a dementia is having violent sorts of behaviors. Neighbors, family members, our society as a whole has a responsibility to our aging society. And as soon as we all step up to the plate and recognize that as we grow older, we might need a little bit more help, but we still deserve all the dignity and respect and kindness and love that everybody in our society should be afforded, we can start having attitudes that say, it is not acceptable for you to be stealing from your mother. It is not acceptable to hit an older adult, even if they struck out at you. It is not acceptable to allow somebody to die under circumstances where they're covered in feces, have a pressure sore, are malnourished because they're old and they were going to die soon anyway. We need to have a society that will not tolerate that type of behavior. And we need to work together with our politicians, the criminal justice system, the healthcare system, the social service system to say, this is so important, we're going to fund you and we're going to help you make sure that older adults are not suffering abuse and neglect anymore. Law enforcement that involves folks like police and detectives need, I think, a lot more training in just how to interview an older adult. And so this is where we really need to form much more team-based care so that folks in the medical and social service communities who understand a lot more about interviewing older adults can help law enforcement do that. We also need to help law enforcement prioritize what's happening with older adults and not think that, well, just they're old, so I don't have time and this is not where I'm going to spend my time right now. I know that when I talk to police officers, many of them, if you give them a choice between going into a dark alley where somebody might have a gun or going into a nursing home where somebody has Alzheimer's disease, they'll take the dark alley because they've been trained for that. They know what's involved there. And I really feel for the police who have to just know so many different things and deal with so many different people. So sometimes I worry about saying, here's one more thing you have to do. But I'm sorry, here's one more thing you have to do. You have to learn how to respectfully interview older adults and take it seriously and understand that this is a crime. And that when something bad may have occurred, be it in a nursing home or somebody's private home, that it needs to be treated like a crime scene. And people can't be allowed to clean up evidence, which often occurs. At the level of prosecutors and judges, I think we need to have attitudes of, this is a crime that we won't tolerate. We do need to send a message to some of the bad guys out there that society will not allow this to occur. So I think it needs to be prosecuted. Some of these crimes need to be prosecuted more vigorously, and that we also need to educate judges so that they understand that these are important cases to have coming through their courtroom. We certainly need better laws. I don't know whether or not we need more laws. I think we need something at the federal level, and not just at every state sort of deciding what it means to be elder, what it means to be abused. And we need more federal guidance and more federal leadership on this. At the state level, we need to understand our own communities to know what some special circumstances may be and what the most effective preventive and early intervention strategies might be at the local levels. I think whether we're in law enforcement, medical care, whatever field we're in, we need to respond in a way that is empathetic and calm and quiet. Very often when people are in extremely high tension, emotional sort of circumstances, you need to let it sort of calm down a little bit, sit down, allow the person to tell you the story, and if the story doesn't make sense, to say to them, can you help me understand really what may have occurred here? And we have to also understand that when the person who abused you is somebody that you love and somebody that has a dementia, what might they be thinking? They might be thinking that if I told the police this is what happened, that they're going to arrest my husband who has Alzheimer's disease. And I think we need to address that up front as well, which is, you know, if this occurred by your husband who has Alzheimer's disease, if the law enforcement folks know that, I want you to know that this is what we would do, and to address some of those fears up front. And I think this becomes very important in all sorts of circumstances. One thing that is interesting to me whenever I talk about elder abuse and dementia is the first thing I tend to hear is, well, people with dementia are abusers. People with dementia can end up abusing, and that is absolutely true. It is interesting to me that we tend to be much more comfortable to talk about those circumstances in which somebody who's impaired is the abuser, when the reality is the more common kind of abuse that's occurring is really people with dementia who are the victims of abuse. So while it does go both ways, I think it's also very important to keep in mind that the more common scenario is the fact that somebody with dementia is being abused by a caregiver. Elder abuse is a worldwide problem. Unfortunately, the vulnerabilities that accompany aging occur anywhere you live. And we do know that this is occurring around the world, and many countries have published different studies, and they all show similar sorts of vulnerabilities, similar sorts of rates. We do know that different cultures view aging differently, although I have to say everybody always tells me that their culture respects the elderly. So I haven't met anybody who has a culture that disrespects the elderly, so that's the good news. The bad news is that sometimes it makes us feel like that would never happen in my culture because we have such high respect for the elderly, and that unfortunately is never the case. I think how we interpret our responsibilities for older adults is different in different cultures and in different countries. Expectations may be different. Family structures may be different. And so it does need to be understood through that country or through their cultural lens. Some of the most important things we can do to first protect ourselves from becoming victims of elder abuse is to exercise, stay as healthy as you can, Plan for the future. Have your finances well taken care of with people that you trust, and to anticipate what might be happening in your future as you get older, and plan, plan, plan. What we can do to protect ourselves from becoming abusers is, once we become caregivers, we need to, again, take very good care of our health, reach out to others for support, recognize when we're becoming stressed and overwhelmed. I now, in my clinical practice, routinely ask caregivers questions such as, I can see that your mom is a real handful for you. And this is done privately now. I'm pulling them out separately and asking privately, how are you doing? Have you ever gotten to a point where you feel like you might hit your mom? Have you ever hit your mom? And depending on their response, we're dealing with it right then and there. So I think it is very important for physicians to be asking these questions of everybody as well. But we all have to recognize that we have the potential to be a victim, and we all have the potential to be an abuser as well, no matter how nice a person we are, that this can happen to any of us. And then if we have hired caregivers or our parents are living elsewhere, we need to be vigilant, we need to be involved, we need to develop relationships and respect the people who are caring for our parents. We need to remind the people who are caring for our parents and grandparents that even though they might be seeing them now at the age of 90 with a dementia, that this person has a whole history, a remarkable history, and to allow them to get to know who this person was as a human being. There's such a tendency to dehumanize people as we get older, particularly if we have Alzheimer's disease, and to start treating people in middle and end stages of dementia as furniture instead of as people that you can just move around. We need to keep reminding each other that they have a humanity and a life and a history that needs to be respected. And I think this can help prevent abuse from occurring as well. I wish we could tell who an abuser is by looking at them and looking at their background and knowing this person is an abuser. Unfortunately, what we've learned is that anybody can end up being an abuser. They can be people who are just cruel, immature, cheerleaders who end up doing something awful like this. They can be somebody who is a real sociopath who ends up sexually assaulting folks, but you don't know what these people look like. They can be men, they can be women, they can be any ethnicity, they can be any age. And so it means that we have to have a healthy dose of concern and suspicion so that we're not unfairly accusing people, but that we're also applying proper protection, and that we keep our mind open, recognizing that anybody can be an abuser and anybody can be a victim.